stakeholder groups, identify best practices in order to transform healthcare. To do that, we conduct meetings, research, we do a lot of policy work, we have these webinars, we've got executive roundtables, and we also have organized a really robust, I'm going to go back to that, a robust resource center. So when you have a chance, take a look at that, do a search and find topics of interest to you. This particular slide deck will be uploaded to that resource center. And just, here are a few of our current members. You can see it really covers, the gambit between payers, providers, technology companies. I did want to let you know that on February 7 and 8, we are having our eHealth meeting here in Washington, D.C. It's going to be really, really interesting. We're doing it a little differently this year. We're organizing the summit into 3 separate executive roundtables. And we've divided the roundtables into value and reimbursement, data access and privacy, workflow and patient experience. And each of these roundtables are going to be led by our board members, Susan Turney of Marshfield, John Zimmerman of GE, and Sam Ho of United Healthcare. So we're really looking to work together to provide, identify best practices, and come out with some very specific deliverables that we can work together. And so I hope that you participate. We would love to have your input. And that's February 7 and 8. So on that note, I'd like to thank Change Healthcare, who's provided support for this webinar. And now I'm going to turn it over to Stephen.
Thank you, and good afternoon, everybody. And thank you for joining us today to discuss disaster and disruption data protection and recovery planning, how BCDR planning and hosted storage solutions can save you money and deliver a peace of mind. So again, as I spoke to today, our 3 speakers today, I am Stephen Ramirez. I'm a senior IT solutions consultant that leads our IT risk security compliance and BCDR, and reporting to Ken Sheppard, who's our practice manager that really oversees our full operations. And then we also have Mike Wilson on. He's the CTO at Datatility, and he leads the technology operations for our hosted storage provider. And all 3 of us will be speaking today really to cover various topics to ensure that your medical systems as well as enterprise systems can be more resilient in this 2018. So for today's discussion, we're going to first start off with really an overview of the current state of healthcare, and then really dive into recovery solutions on what suits you. We will then transition into choosing the right BCDR solution. So what we did is really give 3 case studies of client examples on different solutions that they went with to meet their specific risk tolerance, downtime tolerance. We will then transition that into really data protection, which is such an important component to recoverability. And that's where Ken and Mike will really dive into hosted storage and the benefits of that. And then we will have Mike focus in on really the solution overview, really the back end ins and outs of the system. And then again, we will dive into a client example with that and then open up the line for discussion. So to really just kick it off, the current state of healthcare, as everybody sees here that, 2017 was quite the year for all of us here in the US, but specifically for the healthcare market, that really looking back on 2017, we saw one of the most devastating hurricane seasons. And of course, cybersecurity threats haven't slowed down any. So really looking at that, we wanted to take some lessons learned from 2017 and see how we can use that to better position ourselves for 2018. Perfect timing to, dive into this at the beginning of the new year as well. And in conjunction, if anyone else out there wants to go out and get kind of additional information that our team actually partnered with Continuity Insights to look at healthcare IT BCDR lessons learned from Hurricane Harvey. So we just had an article published last week that really emphasizes some key takeaways that we were able to touch on from, client research, as well as just kind of our connections down in Florida as well as Gulf Coast area. So we'll jump to the next slide. So recovery solutions, what model really suits you? So as an organization, you really need to seek a tailored BCDR solution to meet the unique needs of your organization. There really isn't a one-size-fits-all for every organization. That there are a lot of different factors that really drive an organization's risk appetite. So we really wanted to kind of focus on these key talking points. So first, the enterprise strategy. This really ties in what the enterprise strategy is for IT services, really how they're going to meet their providers as well as patient needs, and then how their IT security and business continuity and disaster recovery are going to align to those specific needs. And to really, boil that down and to get kind of into the nuts and bolts of that, it's really important to also look at the risk to the organization. We all know that, healthcare is, at risk of cyber threats every day. That there was actually an article that came out by the Healthcare Cyber Industry Task Force that gave our overall industry a failing grade for really our overall preparedness and technology defense mechanisms to really combat that. So that's something that the government has really been focusing on since we are part of the critical infrastructure healthcare, that being. So I know that's something that a lot of healthcare organizations across the board globally are looking at to really address. And also after last year that we spoke on earlier, it's really important to remember that they don't happen necessarily all the time, and they're not, the Harvey or Katrina's every time, but it's really important to remember if you're located in a hurricane or an earthquake zone that you really keep that in mind as part of your planning. And it's also important, really the fundamental and most important part of really your BCDR program is really looking at your organization's risk appetite and downtime tolerance. So what is the, you as an organization able to tolerate from having a system outage, having your ER on diversion, and, what really will start impacting, patient care and safety, start having an impact on your bottom line, really putting hospital operations at a standstill. So it's really important to look at that and also quantify these impacts where you can to really justify and show an ROI on these different elements. And that can be done via a IT risk assessment, a business impact assessment, an application impact assessment, really something that helps really encompass your enterprise as a whole to really define those different thresholds to the organization. And it's also important in turn to ensure that you have, proper cybersecurity insurance and also downtime insurance, if that's something that's offered as well. So from a lot of our interactions with clients, we did want to also pose the question, what is more important to you as an organization? Is it uptime and availability of systems or data protection? That really does vary across the board, surprisingly, that you would think that most organizations are like, we have to have our systems up and running at all times. But some of our more rural critical access hospitals, since they're smaller in size and kind of used to, being able to have that continuum of service, that they actually are sometimes more focused on data protection, saying, we'll get the systems up and running when we can, versus, our larger academic trauma one hospitals are more, focused on uptime and availability to ensure that they have those systems to do that real-time diagnostics and other elements. So to boil that down a little bit more, uptime and availability, really going back to that risk appetite and downtime tolerance. That's really having a low recovery time objective as an organization. And that really points more towards a high availability or enhanced recovery, we like to call it, that really, gives you a 1 to 2 hour recovery time and or sooner, really depending on the system and the outage or disruption at hand. And then the data protection element is really having a low recovery point objective. And this is really the threshold that you as an organization set on how much data you are able to lose, some other mechanisms that you have in place that can really keep you from doing that. And that's, again, where that really all ties in all of today's discussion points of how offsite storage, like hosted storage that Mike and Ken will speak to later, as well as a care continuance offering that Change Healthcare offers to as a part of our tax implementations. So now it is important also to really understand what's under the hood and having a good understanding for your internal enterprise infrastructure. Like, what is the current state of your infrastructure? Did you guys, do you have dual data centers? Do you have, redundant networks? Do you have, a multitude of things that really give you a resilient infrastructure? Do you have a virtual or physical? We know that there's a lot of, especially in healthcare, that kind of alludes to that healthcare industry score, that we do have a lot of physician practices, reading groups, and facilities that are still, believe it or not, on physical. And I know the push to a lot of these new EMRs has really, driven us to moving more virtual. So again, with virtual, that provides a lot more flexibility and means of recovery, which is, again, speaking to our VMware tools. There's tools out there like Site Recovery Manager, Zerto, and other things that can expedite recoveries for your organization. And then, it's also important to note that, when you're looking at knowing your infrastructure, what's under the hood, and really setting your disaster recovery strategy as an enterprise, that it's more than just, specifically PACS, us working with PACS, but it really needs to be an all-encompassing strategy. It speaks to your load balancing, your storage, your archive, really stretch network, your upstream, downstream applications, and really that full environment of your IT systems and assets to really cover all of that. So then again, backup tools, there's multiple backup tools out there that really ensure that we have a solid backup in the event we need to recover due to a cyber event like a crypto or ransomware, but also to in the event we just have, a basic database corruption or, somebody accidentally deletes something. So that's really important to tie into your enterprise strategy as well. And then to what we spoke to earlier as well, that it's really also important to really have a true enhanced disaster recovery solution and be a true resilient organization, that it's important to have dual data centers and or utilize cloud services like DRaaS, which our provider Datatility also provides. And then network, that's a huge component. That's a lot of some of the sticking points that we'll run into with our clients, that, having a stretch network, having dual providers, having virtual IPs, especially as it relates to medical imaging, can really expedite that process. And again, it's really important to understand what you have, what the gaps are, and all of that when planning out your enterprise solution. So now we will look at choosing the right solution. So again, that I spoke to earlier, we have 3 different hospitals that we're kind of showcasing for this. And what we will break down in each of these scenarios is kind of the facility overview, the RTO, RPO kind of established, and then the DR solution that this specific organization went to. And we tried to vary the different solutions out there to really give you guys a good kind of bird's eye view of the solutions out there and kind of really how different organizations are protecting themselves. So who today we are calling Hospital A is a 651 bed teaching hospital, a trauma one. They do roughly 400,000 studies per year. And in working with them, we were able to quantify that an impact of a 24-hour outage just specifically to PACS would have a $800,000 plus impact to the organization. So when you think about the footprint of just medical imaging, that's roughly about 40% of the bottom line for many healthcare organizations. But that's a pretty staggering number for just a day's outage. and really on, the amount of revenue that can be lost versus what you can invest to protect yourself beforehand, to be a little more proactive than reactive. So this specific client had 5 virtual app servers and a virtual database within their PACS environment. So in partnering with them, we did establish with their leadership and clinical teams that they were recovery time. They wanted to have their systems up and running within 4 to 6 hours, as well as having no data loss, less than 15 minutes, which, the unique thing about medical imaging is that you're able to push off modalities to really diminish the impact of any kind of data loss. So we worked with them, and after doing a DR test, putting a plan together and doing the whole full solution, that the RTA that we have highlighted in green was a recovery time actual of 5 hours. So what solution did they have that actually drove that 5-hour recovery time? They were supplied with a warm database, which is what we spoke to before as the care continuance solution that we provide really as the standard DR solution with a lot of our systems if the client doesn't already have a VMware tool or instance as a part of their enterprise solution. As a part of that care continuance, the data is backed up every morning and night. You can really work with support to establish that backup methodology to the alternate site, and then there's incrementals done every 2 hours. So transaction logs that if you needed to go back in time to pull a prior because of a database corruption and or some kind of ransomware event, that this is really important that we like to focus on having that tertiary copy. So in the event of a disaster, the hospital would need to resync images from their modalities to ensure there was no data loss, of course, which is, part of the exercise and test and documentation that really viewing the images prior to and then after the failover to ensure that there was nothing lost. And then Recover Point was used to synchronize production and app server configuration. So that's a tool that's pretty similar to Site Recovery Manager and Zerto as well. So we'll hop to Hospital B. So Hospital B is a 4-hospital health system. They do roughly 800 plus studies a year. And we were able to determine that an impact of 24 hours of a medical imaging system outage would be $1 million plus. Within their environment, they have 8 total virtual app servers and a virtual database server. And again, in partnering with them, they have a low RTO, RPO, really meaning that they wanted to have their systems up and running within 4 to 8 hours, having minimal to no data loss, and actually conducting the exercise. And at the end of the engagement, that they were able to recover their systems within an hour. So this really speaks to what we've talked about, and I know a lot of you guys know that VMware and really having a virtual solution is more robust and can really tie in to that enterprise resiliency and address multiple risks. So the solution they had was VMware Site Recovery Manager, very similar to Zerto and the other replication tools that use vMotion to really replicate your compute and everything from data center to data center. The backup methodology they had was the database was replicated every 30 minutes, and then they had transaction logs at the 15 and 45-minute marks to really just ensure that outside of that backup, that they really had that protection in between. And again, what I spoke to, that VMware, Zerto, those other tools all replicate the specs and everything via vMotion from production to DR, so that it's in sync when you fail over. It's almost a seamless failover, that it really takes away a lot of the manual processes, and it's basically shoving your production to the alternate site. And now to Hospital C. This was a rural critical access hospital that does roughly 25,000 studies per year. We were able to determine that an impact of 24 hours would be roughly $95,000. They have 2 physical app servers and a physical database server. So, really to show that difference between some of the larger facilities versus, some of the smaller rural hospitals that we've spoken to, that they're still on physical hardware. So they do have a medium recovery time and low recovery point objective, really meaning that they want to have their systems up and running between 4 to 8 hours, having minimal data loss. So that speaks to that they are a little more focused on data protection versus, the uptime and availability. So in partnering with them, they were able to do a full recovery within 6 hours. And when I'm saying full recovery, again, that's, PACS, doing validation, creating a patient, really the full day-to-day operations that you do and workflow to ensure that that's recoverable. So the DR solution that they used was the care continuance. That's that warm database that we spoke to, as well as the hosted storage solution that really takes care of the archive for the PACS system. And again, that's really something to really focus on, to really wrap up these 3 different scenarios. That, again, it's fairly easy to recover a database and get the app servers and do a lot of those different components with the technologies available today. But a lot of the issues that we see with a lot of the clients, again, is related to network, having that stretch VLAN so you don't have to re-IP, do DNS changes and other stuff for systems, but also really your cache storage, local storage, your archive, and really ensuring that is replicated, available, and at will at your disaster recovery site. So with that, I will transition it to Ken and Mike.
Great, thanks, Stephen. Good afternoon, everybody. Ken Sheppard, I'm the IT Solutions Manager with our MIC group in Change Healthcare. And just want to review the hosted storage with you. I'll be giving you a high-level overview, and Mike will give you a more detailed view of the architecture and how it all sets up. So why is hosted storage important to your organization? So first off, it's a HIPAA compliant solution. It's also FIPS 142 certified. The data that goes into the solution is fully encrypted from when it hits the gateway to in-flight out to the cloud. This solution will enable you to reduce your overall cost of storage for unstructured data while providing a sustainable growth model going forward. Usually, as you are trying to deal with unstructured data, and many organizations have this issue, it grows out of control and you have to keep procuring hardware. And as you go into technology refreshes, it's very difficult to move the data from one platform to the other. So this gives you an avenue to give you that elasticity you're looking for the unstructured data. It also gives you an offsite solution for DR for all of your unstructured data, and it consolidates everything you do to protect that unstructured data, from backup to mirroring and things of that nature. So let's take a look at the traditional storage model compared to the Change Healthcare hosted storage model. So the hardware solution, it's for a traditional storage model, it's on site. It has to be cared for and fed by your staff. Again, you do your hardware refreshes every 3 to 5 years. Most of the time, that data is not protected at rest. And when you have to do upgrades to the technology, you're going to have to do data migration every time that infrastructure changes. And if you have to add capacity, you have to make another CapEx to bring that equipment in, integrate it into your environment, and have it available for capacity. And as you're protecting your data for DR, there might be different solutions you utilize. You might mirror your data. And mirroring, I just want to point out, is not actual protection of the data. You have to have a point-in-time copy of that data to be able to do that, to protect from corruption or ransomware or crypto lock or those types of things, so you can go back in time to that data. And with our hosted storage solution, it's a hybrid cloud model, and Mike will go over this. It's a small on-prem footprint that gives you performance for a local hot disk, if you will. It's fully managed by us. Anytime you have to refresh the hardware in this solution, it's simply putting another device in your site, making it secondary to the primary, and then failing that over to a primary. The whole operation takes around 15 minutes. So it's a stark difference from the traditional storage model, where it could take anywhere from 6 months to a year, depending on the amount of unstructured data you need to migrate over. Again, it's fully encrypted at rest, in flight, and in the cloud. So this is where you pay for only what you use. So it's a pay-as-you-grow model. So you can start out at 100 terabytes. You can grow that into a half a petabyte. You know, it's very difficult to make those kind of leaps with a traditional storage model. And again, it's an unlimited capacity that you have out into the cloud, and it's a data dispersal model, and Mike will go into more of that when we review the architecture. So why is this vital to your organization? So there's many points of benefit of implementing this type of solution. You know, first and foremost, it's HIPAA compliant. It gives you that data elasticity you need to grow, and it really takes, you know, the effort of protecting that unstructured data. And it also provides an avenue for rapid recovery. So that gives you data survivability, gives you continued operations, your reputation and brand protection, as well as revenue generation and protection. And it truly does reduce the cost and burden on your staff of managing as well as protecting that unstructured data. This solution is revolutionary in how you'll go forward with managing unstructured data in the future. I'd like to pass it to Mike Wilson to go over the architecture. Mike?
All right. Thank you very much, Ken, and thank you, everybody, for being here. So I'll skip over a lot of the benefits that they've already discussed so far and just kind of dive into the technology itself. The hosted storage solution is comprised of two main storage components. As Ken mentioned, the on-site cloud filer, which is an all SSD-based local system that sits inside of your network behind your firewall. It is responsible for converting files into objects, which are then stored on the dispersed cloud storage on the back end. The filer does inline encryption, inline compression, inline deduplication if it's appropriate to your environment, as well as being responsible for storing all of the cached, most recently accessed data locally to your environment. On the back end, we've leveraged a geodispersed based object storage rather than a replication based object storage, and there's many benefits to that. You get efficiencies of scale. In this environment, it's 11 nines of data durability. In a replication based solution, you would need to make 5 copies of the data in order to accomplish the same level of protection. We're able to do that, that 11 nines of data durability with a much smaller footprint than 5 copies would require. Another major benefit to the cloud storage solution being dispersed is security. So when data is ingested into the cloud from the Panzera filer, it is sliced into 12 pieces and then simultaneously dispersed to 3 different geographically located sites. So nowhere in the environment does an actual file live on a hard drive. I only need 7 pieces of that data back in order to get bit perfect data. So there's a lot of fault tolerance built into the cloud on the back end of it, and it allows for more efficient file transfers. The system itself is not loaded by back-end replication processes, and as I mentioned, you get a tremendous amount of security by having your data. There is no actual file stored in any one location throughout the environment. Another big benefit that dispersed storage versus replicated storage on the back end gives you is once the initial write is complete, the data is fully protected. So I have accessors in each one of the storage locations, and because the moment a write is complete, it's fully protected, I'm able to read and write data from any location in the environment. So that gives us a big advantage as far as access SLAs are concerned, and allows us to leverage optimized global traffic management in front of the storage solution to ensure that we have, a highly available as well as highly durable, storage asset on the back end. The Panzera filer that resides on site can also have a secondary HA filer associated with it. So if you have multiple data centers, today as part of your DR strategy, the HA filer could live in the secondary facility, and failover is extremely fast in the event that something bad happens to your primary site. All right, there we go. Oop, I think we're missing a part of that one. All right, so one of the biggest challenges that healthcare organizations, and enterprises from a storage perspective are facing today is the growth of unstructured data. So, and as you can see from the first one here, over time, unstructured data is growing at a pretty steep rate. Structured data not so much. And if there was a third, category in that first one, it would probably be IT budgets, and it would more than likely be growing in a downward fashion for most companies. So the way that many companies are addressing this, this issue today is by turning to cloud-based solutions with, for the unstructured data, because that's much easier to tackle than it is the structured data. So by decoupling the unstructured data from your structured data, which typically lives on the same storage systems in most companies, you can offload, that significant amount of unstructured data to cloud-based solutions, and you're essentially replacing all of the storage that would normally be associated with that with a 2U appliance. So it lowers your footprint on-prem, significantly, lowers your colo cost, power, cooling, your need to actually back that data up. So it's a very significant cost savings and also management savings by moving that data to cloud. And as Ken mentioned, in a traditional storage environment, most of the companies that we talk to, we see, a primary site with primary storage, secondary site with primary storage that they're mirroring to, and then additionally, that data has to be backed up to have, proper disaster recovery capabilities. There's usually a third piece of storage, and in some cases also tapes that then get off-sited. So for the unstructured data, by putting in the cloud-based hosted storage solution, you're essentially offsetting all of that with a simple 2U appliance and a managed storage solution on the back end. Now, and the reality is, most companies are storing data and keeping it forever. And as you can see from the third one there, over time, the data gets touched less and less and less as time goes on. And it's a relatively short period of time, 3 to 6 months, less than 10% of the data is ever touched again. However, most organizations are still storing that data, still backing that data up, still mirroring that data, and growing your on-prem storage solutions, for new data to be ingested while still dealing with that old stuff. Next, please. All right, so this is kind of this slide details a use case that demonstrates what the ask was and how we addressed it with the hosted storage solution. So the American College of Radiology approached us a few years ago. Their storage concern was that they are that traditional use case that I was just referring to, where they had on-prem mirrored storage, backup storage, tape storage, and their concern was the growing cost of coloing that, managing it, continuing to keep up with all of the associated with licensing, support, et cetera, even for the backup software. So what we approached them with was, this solution, and managed to replace cabinets full of, primary storage with a single 2U appliance and an HA, virtual machine HA. And because the local caching appliance in the use case, really only called for a small active data set, relatively small active data set, we were actually able to replace all of that primary storage with a solution that performed better than the cabinets full of storage that resided on site. The product, as I mentioned, also has snapshotting capability that can be exposed to the end user. So for snapshots, they were also able to remove all of that unstructured data from their normal backup window. So it freed up a significant amount of software licensing for the backups as well. And then the offsiting for the tapes is taken care of with the data residing in the cloud in 3 different geographical locations with 11 nines of data durability. So the net result of all of that was a much more sustainable growth model where they're not continuing to buy additional storage for multiple locations, additional backup software licensing, tapes, et cetera. They're really just paying for what they consume as they consume it in an OpEx model, and then which led to a very significant overall reduction in costs. Our solution is HIPAA compliant, and as Ken mentioned, data security is probably our biggest focus. The two main concerns that we always hear from people when we talk to anybody about cloud storage is security and performance. So security is addressed at multiple layers. The gateway itself does AES 256-bit encryption inline on the data as it writes to the cloud. It's talking to the cloud over an SSL connection. And then the data gets sliced up and dispersed to multiple geographical locations on the storage system on the back end. So it is a highly secure solution. The performance aspect of it is addressed primarily by an on-prem gateway, which can be sized appropriately for your environment, as large or as small as you feel is necessary, and also has some dependencies on what your network connectivity and whatnot look like. But it's an all SSD based appliance that resides on site, so it's going to be a very fast appliance for on-site data. And then security on the back end is addressed by that same appliance's ability to write in user-defined chunk sizes when communicating with the cloud. It's able to read and write data very efficiently between itself and cloud storage to ensure that you have the fastest possible retrieval times of any data that is stored in the cloud. And I'm going to go ahead and turn it back over to Stephen.
Okay, thanks, Mike and Ken. So really just to give a quick summary to everybody on what we spoke to today. To really ensure the resiliency under stress, it's really paramount to partner with a vendor who can assess and determine the right DR solution for an organization to meet risk tolerance in a variety of scenarios. And again, that's really when setting your DR solution strategy, risk tolerance, that you really need to look at a multitude of scenarios and how you're going to plan for and successfully restore and recover systems from that. Develop exercising and testing to validate the DR solution to ensure that they work during a disruption or disaster. So that's really key, and to what we spoke to with doing our research down in the Texas area post-Harvey, that those organizations that did have validated test and exercise plans actually fared a whole lot better when it was time to actually do those failovers and whatnot. So again, it's important to dust off that disaster recovery plan and also really institute disaster avoidance when you can. It is a nice feature that VMware products like Zerto and Site Recovery Manager have that allow you to fail over pre-disaster for events like hurricanes that actually make a reservation. They're coming and can actually plan for that. So then implement hosted storage solutions for data that offers offsite protection and recovery, ensuring it's really protected against weather events and other disasters. So again, having your data offsite will ensure that you're able to recover it regardless of the solution you have at hand. And then last but not least, review, validate, and advise on ways to improve downtime and continue patient care and hospital operations to really, paint that full picture of enterprise resiliency by really putting all these pieces together and being vigilant to emerging risks and testing and exercising, and really just ensuring that your risk appetite and downtime tolerance are all established can really set you up for success in this 2018.
Steve, did you have a couple questions, or do you want me to dive into some of the questions?
Yeah, if you want to just go ahead and dive in. Sorry.
Sure. What is the most common disaster recovery solution customers have?
And I guess I'll take that first, Ken, and then if you and Mike want to kind of chime in. That we've seen a lot of organizations really move, especially that have virtual environments, move more towards the site recovery manager and Zerto. So really utilizing that VMware recoverability. And we also have seen a lot of clients start moving towards cloud and hosted storage, which is also something important to speak on, when looking at cloud providers to understand if it's a public or private cloud as well, because that gives you an added layer of protection out there. That our Datatility solution is a private cloud versus a lot of other providers are public. So you're on there with everybody else.
So just from someone who is not directly involved in disaster recovery, I was just wondering, a situation like what's happened in California with multiple fires and mudslides, and of course it's impacting hospitals and providers. What they're in disaster response mode. What steps do they take? I mean, is it something that it's an automatic system where their data is automatically saved to the cloud, or does it take time to put things in place? What's the norm?
Well,
go ahead.
Go ahead, Stephen.
I was going to talk about the kind of and let it transition over to you, Ken, on like how hosted storage can be used. That, like what's in California, to what we spoke to, utilizing VMware tools that you can instill disaster avoidance. So that means move to your co-location or DR site to move those systems. And that really ties in, and really why we wanted to have this presentation and discussion today is that really how having your data off-site will always ensure that you're able to recover and protect you against these varied events.
Right. I just wanted to add, every organization has a different risk tolerance. So that's why it's so critical to set those RTOs and RPOs, and to understand, to exercise your plan regularly is the only way it's actually going to work. So you need to really, be diligent in those efforts, because you don't want to get to a point in time when you have a mudslide like what's happening in California, or a hurricane like in Houston, and at the time of disaster find out, oh, we forgot something. That's a problem, and it causes a lot of issues to continuing business operations.
I remember when Texas had the Katrina and Rita, and it was before a lot of things were digitized, and a lot of those files were totally lost. So it's a new day. Yeah.
I agree. It's back in the day, in early 2000s, late 1999, the communications infrastructure wasn't as great as it was today. With the advent of bandwidth availability, it really has let small to medium-sized businesses have availability solutions like the big guys used to have back in those days. So it really has taken a huge leap in capability over the last few years.
And and speaking of smaller or larger organizations, what would you say is the most cost-effective disaster recovery solution? Really providing the most bang for your buck.
Well, again, go ahead, Stephen. We're running into each other.
Sorry. Well, again, just kind of ping pong that answer with Ken. That will. Again, really, with the push and affordability of virtual environments, that we are seeing a big shift to that VMware Zerto Site Recovery Manager for that ease of recovery. So that's really, for the price that it is today versus what it was, really is the most bang for your buck. But again, to what I'm sure Ken will allude to, that it is, it's more than just having, the app servers, database, and all of those different components. It's really a lot, related to storage, archive, network, and those different pieces that I'll let you speak to, Ken.
Yeah, and then, that is very true, Stephen. Is having all of those components in place and exercising those things. But also, when you look at the broad organization from a business continuance perspective, it's having all of those stakeholders involved in the process as well, so they know what to do at time of disaster. Back in the 90s, during the first World Trade Center disaster, I was working with a company called Comdisco, and one of the issues that customers were having, they were never at the recovery facility. So they were actually calling our front desk asking, how do you get to your facility? And they never went through exercises, so it really hampered their efforts to get their people into the recovery facility and actually begin business operations again. So, those are the types of things you have to look at to understand, to bring the whole organization into the fold when you're doing this planning and exercising.
Would you say that most providers, I'm sure that most providers have a disaster recovery solution. Do you think it's primarily cloud-based?
Not today yet. A lot of customers still haven't breached into the cloud. A lot of customers are using their own facilities to set up that effort. I think, as the years go on, you're going to see more and more going into the cloud. And as the technology tools, become greater and peripherate the market, you're going to see more of that, coming, like the DRAS solutions, where if the customer has a single site or they don't have the right components on site, or you might see customers also going to a colo to set up their DR solution. That's another option. And again, that's all afforded to customers these days by the enhanced communications that are available to them.
And to
I'm sorry, go ahead.
I was going to say, to piggyback off what Ken said, that we know in healthcare that IT is generally not a revenue generating business unit. So again, there's more and more push to free up space and allow for more patient care areas and whatnot, and of course offsetting the cost of the heating, cooling, having generators, all those other aspects that really the move to the cloud and virtual machines really helps diminish that footprint at a lot of these healthcare facilities.
I would think that there are several hospitals in rural areas that sometimes don't have the internet bandwidth. Does that get in the way?
It does, and in those situations, you have to look at alternate solutions such as network shelter servers or in-place solutions that can hold them over until communication circuits can be brought up. And really, that's the case with larger organizations as well, especially Trauma One centers that need to have images viewed. They'll have standalone solutions in those Trauma One centers, so if they're an island, if you will, all the communications are cut off, that they can still view image data and serve their patients.
So in working with clients, any kind of surprises in terms of the choices that they make? Yeah, I remember in terms of, your overview of hospitals A, B, and C, how is it that hospitals determine whether they're going to focus initially on the patients or focus, have some downtime and focus on that data recovery? How do you make that decision? That's really, I would think that'd be really hard to do.
That really ties into the impact on the overall patient care operation. So if it's, again, like we're speaking to Trauma One a lot, that if it's that, you need to be able to address a multitude of different, health issues at any given time, that you have to have all of those resources, all of those tools readily available, because you don't know what's going to walk through your door, versus maybe a rural hospital that, is able to do the bare minimum, do this, or this, that would likely transition or transport, a higher acute or trauma incident to another location anyway. So it's really, tying that in, getting a feel to, like we spoke to, the downtime tolerance and risk appetite of the organization, and really, going and looking under the hood on what the upstream, downstream impacts are for different scenarios and system outages, and then ensuring you have downtime procedures that are tested, as well as having the technology side that, you know, you're able to recover and get those systems back up and running.
What would you say for providers that really haven't created a robust recovery system yet? How long does it take to do this? I mean, I would think that with all the data that they've got stored, it would take a long time to then move that data over into a cloud system.
And it really depends on, you know, the provider, to be honest with you. And, you know, there's a lot of steps that have to go into, you know, understanding what you have to recover, number one. You know, what kind of money is it going to cost, number two. You know, what kind of risk are you willing to accept? And really, you know, it comes down to what do we have to do to continue to provide quality health care to the patient? Because that's really the number one goal.
And to piggyback off of that too, it's, you know, really important when establishing your BCDR program that you have to crawl before you can walk. So it's really about establishing a lot of our clients where we would start is doing more of a data protection model, ensuring that you're able to recover it, your systems at your offsite while you kind of, you know, put together that enterprise strategy. And that's, again, for some of the organizations that are more in their infancy stages of creating DR strategies and solutions versus, you know, more of these advanced clients that we have as well that, you know, really just utilizing what systems they already have and, you know, being able to encompass and align to that established downtime tolerance.
So as a last question, I'd like to ask each of you if you had, you know, recommendations, suggestions for the folks on the line. You know, what are your what would you like to say as some last comments?
Well, I think I'd like to say, you know, make sure that you have everything covered in your organization. Also, exercise. The only way you know if it works is if you exercise the solution.
And again, I would emphasize exactly, you know, what Ken had said, and really, you know, get a feel for what you have as an enterprise that you can utilize. Because again, it shouldn't be a one-size-fits-all necessary solution, but you should be able to utilize other systems that you have for your main EMRs, your PACT, you know, the environment that you have out there to, so you're not necessarily recreating the wheel, just making the wheel better.
Yeah, absolutely. And since my background's more on the, you know, the storage and the network side of the house, you know, I would encourage, you know, people to look at the, you know, some of the newer network technology. You know, anybody living on an old network contract, the MPLS networks, and, you know, talk to you know, local providers. Connectivity might be available in your, you know, in your area now. So Metro E pricing has come down significantly, which does allow for, you know, to pick up more bandwidth at various locations. You know, and also, you know, if not there already, you know, certainly look into, you know, putting as much as possible into colo or cloud-based solutions, you know, to allow for better durability in the event of an issue occurring, but also recoverability because of the connectivity that is, you know, afforded to you by being in a colo.
Well, I really want to thank all of you so much for such an interesting and informative discussion. It's been, you know, we're, for the participants, you know, we will be having this PowerPoint and as well as the audio that will be stored on our resource center. And if you have any other questions, don't hesitate to reach out. You can send these to me. And we look forward to seeing you on our next webinar. And I'd like to again thank Change Healthcare for their support of this webinar. So I wish thank again the speakers, Change Healthcare, and the people who participated on the call. Thank you all so much.
All right.